Welcome to Understanding Health Equity, Social Determinants of Health. I'm Danielle Andrews, the Health Equity Specialist from the IPRO ESRD Network Program. The IPRO End-Stage Renal Disease Network Program includes 4 different ESRD networks. Network 1, which is ESRD Network of New England. Network 2, which is ESRD Network of New York. Network 6, which is the ESRD Network of the South Atlantic. And Network 9, which is the ESRD Network of the Ohio River Valley. The mission of the IPRO End-Stage Renal Disease Network Program is to promote healthcare for all ESRD patients that is safe, efficient, effective, patient-centered, timely, and equitable. This presentation was made in collaboration with the Weizmann Institute. The Weizmann Institute is the first and only community-based research center established by a federally qualified health center. Its mission is to inspire innovation through research, education, and policy work to ensure that effective, efficient, and equitable primary care is available to all. The Weizmann Institute utilizes cross-functional teams working with national partners in 3 priority areas. The first is research, evaluation, and policy. The second is transforming care delivery with Weizmann education. And the third is training the next generation of healthcare leaders. So what are social determinants of health? According to the National Academy of Medicine, social determinants of health are factors in the environment where people are born, live, learn, work, play, worship, and age. An individual's overall health and well-being is affected by access to equitable healthcare. However, their general environment, community, interpersonal relationships, and education are also the fundamental drivers of an individual's overall health. Commonly, it is understood as socioeconomic factors such as neighborhoods, education, housing, and wealth, and these all the things that help shape health and social policies. So when we're talking about social determinants of health, we focus on economic stability, access to education and the quality of education, healthcare access as well as the quality of their healthcare, neighborhood and built environment, and social and community context. Some examples of social determinants of health include safe housing, transportation, and neighborhoods, as well as racism, discrimination, and violence, education, job opportunities, income, access to nutrition foods and physical activity opportunities, polluted air and water, language, and literacy skills. So this graph highlights how there are different aspects of social determinants of health, including economic stability, which is broken down into employment, income, expenses, debt, medical bills, and support, as well as neighborhood and physical environment broken down into housing, transportation, parks, playgrounds, walkability, zip code, and geography, as well as education, understanding literacy, language, early childhood educational, vocational training, higher education, food security, access to healthy options, and then community safety and social context, which is social integration, support systems, community engagement, stress, exposure to violence and trauma, policing and justice policy, and then the healthcare system, which is including health coverage, provider and pharmacy availability, access to linguistically and culturally appropriate and respective care, and quality of care, and how all of these function together to improve or decrease the health and well-being of an individual. So now let's look into social determinants of health in the COVID-19 pandemic. So during the course of the pandemic, millions of individuals have lost their jobs and had limited access to basic necessities such as food and housing. So about 13.6% of adults, or that's 1 in 8 adults, reported that they or someone in their household had experienced a loss of employment income in the past 4 weeks. More than 6 in 10, or 61.3% of adults reported at least a little difficulty paying for usual household expenses in the past 7 days. And 31.8% use credit cards or loans to meet household spending needs. 7% of adults had no confidence in their ability to make next month's housing payment, and 10.3% reported food insufficiency in their household. Nearly 1 in 3, or 31.4% of adults, reported symptoms of depression or anxiety. So let's talk about social determinants of health in terms of access to care. Large urban and rural counties see lower percentages of patients receiving pre-ESRD nephrology care compared to suburban and medium to small urban counties. Females, white, non-Hispanic, and older patients are more likely to receive pre-ESRD nephrology care. Low economic status and low educational attainment are associated with a higher prevalence of ESRD. Low educational attainment, being of the African American race, poverty, and unemployment are all associated with lower rates of kidney transplantation. So this highlights, broken down by race, it shows adults that experience hardship by selected demographics between March 2nd and March 14th. Of those, 75.2% of Hispanics and 74.4% of Black people experience hardships in relation to expenses in the month of March. This is highlighting individuals that were suffering from depression or anxiety broken down by race. Individuals ages 18 to 25 tended to have the highest level of symptoms of depression, anxiety, and then individuals that are described as other race described to have the highest level of depression, anxiety. About 43.1% of these individuals were showing symptoms of depression and anxiety. And this one is highlighting the likelihood of having to leave a house in the next 2 months due to foreclosure or eviction. So again, we're seeing 39.3% of Black individuals showing hardship, and then 38.9% that are identifying as an other race experiencing larger hardship. So this is highlighting the individuals that are using credit cards or loans to meet their household spending needs. So it seems to be relatively even among all races as well as among all ages, showing at least 30% of people in each group having to use credit cards or take out loans just to meet their household spending needs. So let's highlight intersectionality. Intersectionality describes the way in which systems of inequality based on gender, race, ethnicity, sexual orientation, gender identity, disability, class, and other forms of discrimination intersect to create a unique dynamics and effects. All forms of inequality are mutually reinforcing and must therefore be analyzed and addressed simultaneously to prevent one form of inequality from reinforcing another. So when we're talking about this in terms of dialysis treatment, we have to look at an individual has multiple identities, whether they have a specific sexual orientation, their race and ethnicity, their gender, their social economic status, if they're able-bodied, if they were born in America or not, whatever their first language is, and their religion all come together to create an individual identity. When you are dealing with an individual who has specific identities that come together to create one, their treatment needs to be specified because their identities help to determine their behaviors and different ways that behavior modification will be effective for them. And these are references.